OET, or the Occupational English Test, is an English language test developed for 12 different healthcare professions. What makes it different from HiHello is that in OET, the candidates' listening, speaking, reading and writing skills in English are tested within the context of the medical field. If you are a healthcare professional and are planning to migrate to any of these countries like UK, Ireland, Australia, New Zealand, Dubai and Singapore, the OET could be the better option because it uses profession-specific content for testing your English language skills, whereas HiHello tests English within the context of a wide variety of topics. The duration of the test is approximately 2 hours 45 minutes and 4 different skills, listening, reading, writing and speaking, and be tested. Listening subtest is same for all professions. It consists of 3 different parts, A, B and C, and the duration is about 40 to 45 minutes. In part A, you get 2 consultation extracts. In each extract, which is approximately 5 minutes duration, you will listen to a consultation between a healthcare professional and a patient. This is the first part of part A of a sample question paper. The context of the conversation is given in the beginning. It is a physiotherapist talking to a patient, and you will get 30 seconds to read the notes before the start of the conversation. The conversation goes in the order of the notes and the headings are your guide. Since this is a consultation, the patient must be introducing himself and the reason for his visit in the start of the conversation. In the 30 seconds time that you get, you have to underline the key words while you read the notes. Now look at the blanks over here in the notes. The keywords over here are the headings and or the headings or the subheadings, and words or phrases that are used before and after the blank. Here in this question paper, you have to listen for an information about something that happened 18 months ago, and it is something about an injury, back injury sustained by lifting. So you have to get the answer over here. So mark all the words and phrases and headings related to that particular blank. So do the same for the remaining parts in 30 seconds time. One thing I would like to point out here is that if you get a full sentence under a heading, it usually marks a slight change in the topic. However, in this note, there is no such sentence. I just told you for your information. In part A of listening test, you can use commonly accepted abbreviations like BP for blood pressure, BMI for body mass index, etc. You would not be penalized for minor spelling errors. That means if you don't know the exact spelling of a disease condition or a medication and you write a spelling which is close to the real one, then you will get the mark. If you make a mistake while writing, don't waste time by erasing it. Instead, just strike it off and write the correct word. And if you don't find an answer, don't get stuck. Move forward, otherwise you would lose the following answers too. At the end of the consultation, you go back to the missing blank, and my suggestion is make a guess based on the listening and write an answer, because you don't get any negative mark for a wrong answer. Also in part A, since it's a consultation, a knowledge of pain collocation will be very helpful. Unlike part A, in part B and part C, you don't have to write anything. It is MCQ type, that is, what you get in part B and part C are multiple choice questions. So just mark the correct option. In part B, you get 6 short workplace extracts, approximately 1 minute each. Each extract is followed by a multiple choice question and you need to mark the correct option. After each extract, you get 5 seconds to mark the answer. So the right approach to this part is read the situation, then listen to the extract and then mark the correct answer in 5 seconds. In part C of the listening test, you get 2 presentation extracts of approximately 800 words and each will have around 5 minutes duration. What you get to listen to is usually an interview or a workplace presentation. Each extract has 6 multiple choice questions. So altogether, you have 12 questions to answer. Part C is comparatively the most challenging part of the test. However, in this part, your background knowledge would be very helpful. You will have 6 different multiple choice questions under one extract. Before the start of the audio, you will get 90 seconds to read the questions. During that time, read each question carefully, try to understand what information is being asked for, and mark the important words. While listening to the extract, you have to look for the information you require. Don't think that you will get direct questions in this part. Most of the time, you need to infer the answer. Don't wait to hear for the exact keywords given in the question, because you might be getting the synonyms, that is words that have similar meanings in the extract. One highly recommended way to come at the right answer is by eliminating the wrong answers. Like listening subtest, reading subtest is also same for all professions. In the reading test, you have to cover 3 different parts, A, B and C in 16 minutes. But basically, these 3 parts come in 2 sessions. The first session has part A, which is an expeditious reading task of 15 minutes. The second session has part B and C, which have careful reading tasks, and the duration is 45 minutes. Part A task of the OET reading test is called expeditious reading task. You have to answer 20 questions which consist of matching, short answer and gap filling in 15 minutes. While you do reading, use the pencil as a pointer from left to right in a continuous motion. Try to keep your eye position above the tip of the pencil. This would help you to guide your eyes along with the line you read, as eyes are naturally attracted to motion. You can increase the pace of your reading gradually, and this in fact is a scientifically proven method, and those who practice fast reading do this way. When I tried, I was able to read faster when I covered the following lines and read using a pointer like this. Try and see whether that is working for you too. Another technique to improve reading is by avoiding or at least minimizing subvocalization, as it would slow down your speed. One more thing you need to practice is to read in chunks. That is, try to read 3 to 5 words together, not individual words. And while you do reading, try to mark the keywords and phrases. In part A, you get 4 short texts followed by a set of questions that include matching, short answer and gap filling. And the time limit is 15 minutes. So how you plan your attack? My suggestion is to use your first 2 to 3 minutes to read the text and the rest of the time, that is about 12 minutes, to answer it. Read the questions and go back to the text to get the answer. In part B, you get 6 extracts of 100 to 150 words each from the healthcare workplace. Those extracts include policy documents, hospital guidelines, manuals or internal communications such as emails or memo, and each text is followed by a multiple choice question with 3 options. Here you get the situation, then the MCQ followed by the extract. First, read only the question given, not the choices. Underline the keywords in the question while you read. This will give you a clear idea of what you are looking for while reading the extract. Then try to read the extract in 1 minute. By the time you finish reading, you might be knowing the answer if you have understood what you have read. Read the choices and mark the correct options. In part C, you get 2 800 words text, and each text is followed by 8 multiple choice questions. Since you have 2 such tasks in part C, you have to attempt 16 multiple choice questions in total. Part C is the most challenging part of all parts because the questions asked are mostly not direct. You need to infer the meaning from the passage and choose the correct option. Sometimes synonyms might come in the question, so looking for those exact words won't help. A proper comprehension of what you've read is very important. The OET speaking test is profession specific. That is, what you get to perform is similar situation from your workplace, and the duration is about 15 to 20 minutes. And in that 20 minutes, you have to perform 2 role plays of 5 minutes each after a warm-up session which is not evaluated. Before the start of each role play, you will be given 2 to 3 minutes for preparing the task. In the role play, the examiner takes the role of the patient and you would be the healthcare professional. Your real speaking task is the role play. In fact, you have to do 2 role plays on the test day. While you're preparing for the test, it is very important to have a clear picture of the format and the scoring of the test. It would help you to have a better understanding of how to demonstrate the required skills in the key areas. Your performance is scored against 9 criteria and a band score is given to each criterion. So here in the test, your language ability, which includes pronunciation, intonation, accent, fluency, appropriateness of language, and use of grammar and expressions are tested. One of the best possible and easiest ways to improve your speaking skills is by listening to English audios and videos. In the part A of your listening subtest, you get 2 consultation extracts to listen to and write answers. Since it's a consultation extract, what you get there is actually a conversation between a healthcare professional and a patient in a natural setting. This will help you know and understand how questions are being asked, how things are explained, how the healthcare professional responds to the queries and concerns of the patient, and so on. Just take a conversation from part A and listen to it repeatedly while you travel or whenever you get time. Listen carefully to the words used, see how phrases and sentences are used to explain a condition, how questions are being asked. This would give you a clear picture of how a normal conversation takes place. Once you are familiar with the words, phrases and sentences, try to recreate the same situation. If you have a partner, it is well and good. Do it with your partner, and while you try, you don't have to do exactly as you heard in the conversation. Instead, be yourself, but try to use the words and phrases that you heard in the conversation. You may ask me, what if I don't have a partner to practice with? Well, then too there's a way. Stand in front of a mirror and talk to yourself. Since you know what response you're going to get, you can easily do that. First, how to carry out the conversation. While you do the role play, try to start, maintain and conclude the conversation. That is, once the preparation time is up, you should not wait for the interlocutor to start the conversation. Instead, you start the conversation and keep the conversation moving by leading the conversation. It is easy to start a conversation by asking a set of questions that you normally ask depending on the scenario. The situation given gives you an idea whether the patient is already known to you or you are meeting the patient for the first time. For example, if the scenario is an OPD, you can start like, "Good morning, I'm so-and-so, your nurse today. What's your name?" Or "How can I help you?" Or "What brought you in here today?" And so on. And if the scenario is a hospital ward, then you already have information about the patient. So you can start the conversation by addressing the patient like, "Good morning, Mr. Jones, how do you feel today?" Or "Did you sleep well last night?" Or "How is your pain now?" Or "Have you had your breakfast?" And so on. And another thing you should be aware of while performing the task is that This speaking test is not testing your clinical knowledge, but your ability to communicate in English, your control over the language, how you deal with the situation, how you gather information and clarifying the doubts and concerns of the patient by providing correct information to the patient. Never let the conversation get stuck or stop the conversation in the middle. You need to ask questions to keep it moving. For instance, if you have a patient with urinary tract infection, instead of asking, "Do you have pain while passing urine?" ask him or her, "Could you describe the pain to me?" Because when you ask yes or no questions, the conversation may get stopped there. So in order to keep it moving, ask questions where the patient asks to talk. However, do not interfere while the patient talks. Allow the patient to talk and listen patiently to what the patient has to say and respond appropriately. Be polite, sympathetic, and the patient should get the feeling that you are there to help him or her. The writing task is to write a letter referring the patient under your care to some other healthcare professionals depending on the need of the patient. That letter would be an essential means of communication giving the recipient a brief but all essential information regarding the patient under your care to ensure a smooth transition of care. So on reading that letter, the recipient should get a complete picture of what is to be required while the patient is brought under his or her care. The task can take different forms like a referral letter, a letter of discharge, or a letter of transfer, and so on. While attempting OET writing, the first thing you need to do is to read the last part of the case note where you have the task. The writing task contains information about whom you are writing and why you are writing the letter. You will get the recipient's name, the recipient's designation and address, and also a reference to what type of letter you must write, like referral, discharge, transfer, and so on. You can also infer from the task that whether the recipient knows the patient or whether you are introducing the patient to the recipient for the first time. After reading the task, go back to the start of the case notes. When you read the notes, pay attention to the notes that are relevant to the task. While writing, it is always better to try to follow the word limit, and the word limit of the letter is between 180 to 200 words. However, it is okay if there are 5 or 6 words more or less than the limit. Let me give you a general framework or an idea of how letters should be organized. First, you keep in mind that everything you write should start from the left margin. The letter should start with the full name of the recipient and the address followed by date, which will be the date of your OET test. It is better to write the date in expanded form. Then the salutation, here you can write the title, that is Mr. or Miss or Doctor, taken from the task followed by the surname. Next, you need to write the full name of the patient you are referring and his age. You can either write his age like 56 years old or age 56 or the date of birth. Though these are minor things, but in order to make the letter look complete, these are needed. What is most important is how you communicate the matter in the letter. You don't have to write anything from your knowledge. Instead, what you need to do is to obtain information from the case notes or other related documents given in the question. Your first paragraph or the introductory paragraph should clearly mention why you are writing the letter, or in other words, the purpose of the letter in brief. Leave a line after each paragraph. Otherwise, it is difficult to differentiate between the paragraphs. Paragraphs 2 and 3 should contain the medical history, that is the condition of the patient at the time of admission and the treatment given under your care, or if it is a clinic visit or a home visit, these paragraphs should deal with the condition of the patient during the visits. In paragraph 4, you can give the essential social background of the patient. but you should write this paragraph after the introductory paragraph if the social background is critical in the situation given. In paragraph 5, you can give further management plan required for the patient. It can be a discharge plan or a treatment plan or medications to be continued. Your paragraph 6 can be your concluding paragraph. Then you can sign off saying yours sincerely. Please note that Y of yours should be capital Y and there is no apostrophe after R in yours, and the S of the sincerely is small. Then you write the designation of the writer given in the task.